Good morning, everybody. Welcome to Grand Rounds. We've got a very special presentation this morning on human trafficking. We have three presenters, Dr. Sarah Beaumont, Dr. Amy Williamson, and Ms. Jade Richard. Dr. Beaumont is the medical director of the Homeless Youth Outreach Clinic. Dr. Williamson is the section chief for Pediatric and Adolescent Gynecology. And Ms. Richard is a graduate of the Where Hope Lives program at the Phoenix Dream Center. So please welcome Dr. Beaumont.
Thank you. Before I go into some of the information we're going to talk about, I want to talk about our relationship and how Amy and Jade and I work together, in essence. About 5 or 6 years ago, the Crewsn Healthmobile started to go out to Phoenix Dream Center, which is a nonprofit that provides a wealth of services to homeless youth and survivors of sex trafficking. And eventually, through the generous donation of the late Bruce Halley, he and his wife funded a full-time clinic there. And right now, we provide services to youth 25 and under. Amy provides OB care and gyne care to those as well. And so that's how this relationship came up. We see people who are victims of sex trafficking on a daily basis, and we think it's really important for us as a medical community to learn how to recognize and help. So our goals here are to understand the scope of sex trafficking in our community, learn how to identify victims of sex trafficking in the medical setting, and how to better address their medical and psychologic needs. And we have no financial disclosures. I think it's important to define human trafficking. The Federal Traffic Victims Protection Act of 2000 defined it as the recruitment, harboring, transportation, provision, or obtaining of a person for the purpose of a commercial sex act in which it is induced by force or fraud or coercion, or if the person is under the age of 18. How are the children that we are seeing exploited and the youth? It can be through prostitution, through pornography, stripping, or the erotic entertainment industry. A lot of the information I'm going to give you today has been done out of the ASU's Office of Sex Trafficking Intervention Research. Dominique Sipowicz is the head of this program, and they've worked very hard to just compile information that we didn't really have up until now. They recently published a study that looked at sex traffickers that were arrested over the course of 6 years. And with that, they found out information about sex trafficking victims. So just some brief data. This was nationwide, not just Arizona information. 98% of the victims were female. I will caution you and say that we are seeing more and more male victims nowadays. The average age of first exploitation is 15 nationwide, but in Arizona it is 14. And 2/3 of the victims were runaway. And to give you a larger perspective, it's estimated that about 1.6 million youth are runaways every year. Other populations, throwaway teens, parents who kick their kids out because maybe they don't like decisions that they're making. And then foster youth. The National Center for Missing and Exploited Children, there's a little graphic here, and of the 25,000 runaways that are reported to their a website, 1 in 7 were likely victims of child sex trafficking. And even more frightening is 88% were already in the care of social services when they went missing. So who is targeted? We know that a lot of the kids who are targeted have a history of violence and trauma in their lives. But it's important to recognize that it can impact anybody. They come from diverse socioeconomic backgrounds, varied educations, whether it's someone who never went to high school or someone who has been to college. I remember hearing a story of a collegiate gymnast who got into drugs, and then the drugs took her down a different pathway that led to trafficking. You can find it in urban areas, suburban areas, and rural areas, and often there's a history of substance abuse. You can find different data, but in general, within the first 48 to 72 hours of being homeless, youth will be either solicited for sex or have sex for shelter, anything to protect themselves. So where do they find the youth? I put shopping malls first because this was my first experience with someone who had been trafficked. It was actually in our general pediatrics clinic here. It wasn't even on our mobile health unit. And she came to me after being hospitalized related to complications from medications. And she was walking at Arizona Mills Mall. She was 13. She was mall walking with her friends. I think we've all probably done that. And someone approached her and said, "You are beautiful. You are gorgeous. And I think that I think you should be a model, and I know how to help out with that." And she was in a rough place in her life. Her parents were getting divorced. She was feeling a little alone and looking for warmth and validation, and this person gave it to her. And they first started out with just regular pictures, and then the pictures moved to, "Well, why don't you take your clothes off a little bit?" And then the next thing she knew, she was being trafficked back and forth from Phoenix to California. And she got picked up by the police in California once, was put into a group home here in Arizona, and her trafficker found her again, and then she was back out in California. So if it weren't for a bad reaction to a self-medication that got her hospitalized, she would not have actually returned to the safety of her home. But they go to bus stops, they go to schools. I was listening to a trafficker talk whose sort of area was the Central Phoenix area, and he said, "I know everything that is going on at North High School." That's just a couple of miles that way. "I know whose parents are divorced. I know whose parents have been deported. I know who's depressed. I know who's on drugs. I know everything about them," so that they can identify them and try to lure them into the trade. And then online is becoming more and more prevalent. We talk about safety online with our kids. We never know who they're talking to. How old is that person? How are they befriending them? So internet. Once traffickers target their victim, it's about gaining the trust and information, and oftentimes they're finding people who are at vulnerable points in their lives. So they learn about their victims, and then they feel a need, whether that's love, affection, just someone to listen to, and then the isolation begins, and then the abuse. This data is from so the next few slides are all going to be referencing the STIR data that I initially talked about. In general, most commonly, the traffickers would promise wealth and money and a place to stay. Almost 20% were gang affiliated, and a third had history of violent crimes and drug possession. The table there talks about what their relationship was to the victim, and over 50%, so that's the friendly stranger and the complete stranger, were unknown to the victim beforehand. But I don't know what's scarier, like the unknown person or the friend, the romantic partner, or the family member that lured them into the trade. This study also looked at occupations of the trafficker. And so if you look, 28 private service, and that's truck drivers, taxi drivers, but then people who are in positions of authority and public figures, 8. 7 were in law enforcement. So people in jobs that we would trust are luring people into sex trafficking, or coercing is probably the better word. There's a lot of different terminology, and I'll go over lingo as well later on, but you will have your guerrilla pimp, and this is the one who intimidates through physical violence. Your Romeo pimp, and this is the one who gives you love and affection, but also manipulates you through psychologic mechanisms. But usually physical force is a backup for them. There's the gang pimp, and then there's the family pimp, so you're being pimped out by people that are your family. This is a busy slide. It's got a lot of information. The initial picture of the states just shows different trafficking routes that our youth will go through. And in this study, the average number of states that a victim traveled through was about 2.7. The pathway here is usually the Arizona, California, Nevada pathway. A lot of the ways to solicit Johns or tricks are through the internet. And has anyone here heard of Backpage before? So Backpage is an online company that's basically become famous and quite rich, like $1 billion industry, with its escort services. And there's been a lot of news about them lately, because they knowingly have allowed sex trafficking of youth and of adult women on their website. And there was a wonderful documentary called I Am Jane Doe that addresses this. A lot of the survivors, because of how they were prostituted online, tried to sue Backpage. And our wonderful federal government created an act called the Communications Decency Act that said any internet domain cannot be held accountable for the actions that then happen from that domain. And so these victims were suing Backpage, and they were not winning, essentially. But this year, there is a wonderful bipartisan effort to create a law to amend that Communications Decency Act so that places like Backpage can't continue to make millions and millions of dollars off the sale of young adults and children. Trafficking locations, where it happens, most often it's a hotel room, but it can occur, the out-call locations where the John wants them to meet, houses, streets, apartments, and clubs. In Arizona, there are different locations where there's more youth that are being trafficked. So one track or blade or stroll is along 27th Avenue between Indian School and Northern. And that's popular because of its proximity to hotels and the I-17. I want to just point out that hotels are also complicit in this because they know what's going on. And the proximity to the I-17 is an easy escape as far as moving on to your next city. And then 51st Avenue in McDowell is also very popular, and that's because of its location I-10, a lot of hotels, and not a lot of risk of reporting because of the prevalence of prostitution and trafficking. So the next set of data is out of the Youth Experiences Survey, and I'll just sort of talk about homeless youth in general. This is conducted through the STIR group at ASU as well. And this looked initially just at homeless youth. So they completed almost 200 surveys. Average age was 21. 51% males, 41% females, transgender 4.5. More than 50% had used drugs or alcohol. 40% had attempted suicide, and almost 60% had a mental health program. So this is a glimpse or a snapshot of homeless youth in Arizona. Of that, 33% had identified as a homeless, as a sex trafficking victim. So 1/3. And then even more interesting is that if you look down to the breakdown here of the sex traffic group, it was almost 50-50. 47% identified as heterosexual, and then 52% identified as LGBTQ. Okay, so this is how they broke down what they were looking for: money, so they could have a place to stay, so they could have food and clothes and protection. If you look at substance abuse, and I'm going to compare the sex trafficking group to the non-sex traffic group, there's definitely an increased risk of drug addiction, so 24% to 11%. Alcohol addiction was 19% to 7.5%, and meth use was 15 to 5% use. So our sex traffic group has a lot higher risk activities or self-harming behaviors. So the total here is self-harming behaviors, and they break it down to not eating, cutting, drug use, et cetera. And pretty much universally, the numbers of the sex traffic group to the non-sex traffic group are higher. Mental health, increased risk of suicide attempts in the sex traffic group versus the non-sex traffic group, 68% to 26%. Comorbid medical conditions like depression or anxiety, post-traumatic stress disorder. And then there's the technology. You know, we talked a little bit about online, and in our initial survey, about 35% had been solicited online. This is how they're being trafficked here: smartphone, Facebook, dating websites, Backpage, Craigslist. It's a new age, and it's easier to get around things using technology. So why are we, what was our purpose here today? It was really to sort of give you guys some of the information, but also talk about how we as medical providers can identify and better treat survivors of sex trafficking. So data shows that 88% of victims, this is nationwide, have come into contact with a medical professional while involved in trafficking. In our study, the Youth Experiences Survey, 40% 48% had been seen in an emergency room, 39 in urgent care, 24 had a primary care doctor. So they are seeing us. Whether we are asking the right questions or recognizing that something is up that needs to be pursued is the problem. So physical indicators of sex trafficking. You might see evidence of sexual trauma, cigarette burns, bruises and fractures, tattoos. They may come in with chronic health conditions. In Dominique's survey, over 20% had chronic health conditions, chronic back pain, chronic dental pain, stomach pain. It can get more severe, chronic bladder damage, TMJ problems, bite marks, bald patches, recurrent sexually transmitted infections. These are the things that should be triggering you when you're seeing your patients. We talk. How do they, pulling hair, violence? Yeah. I talked about tattoos, and branding is a big thing. So there's all different types of branding, but sometimes it'll say your pimp's name across your chest. But that's why we've tried to have efforts in the past to get laser tattoo removal, and that's something that's always in the back of our mind. Other red flags, there may be a discrepancy in the age of what they report to you and what they look like. Maybe there's an older male that's in the room who doesn't leave. They're just visiting the area, they're transient, they don't have an address. Maybe they're using certain words that you haven't heard, and this is just sort of a brief entry, but so we talked about branding. Their daddy, the guy who brings them in, or their family, the John or the Trick. One of the interesting things about this initial STIR study is they looked at the sex traffickers, and 25% were women. And so the phrase bottom, that's a female who may have been a victim of sex trafficking at some point, who's picked to recruit victims, supervise, instruct, collect the money, inflict pain if they're not doing what they're supposed to. So I think that's an important thing. We have this vision that they're all males, and that's not necessarily the case. I am going to segue to Dr. Williamson. Come up.
So through the same clinic over at the Phoenix Dream Center, I now go and do an OBGYN clinic through Dignity Health through St. Joe's. And so a lot of the women that I see there have been sex trafficked. And there's a video that I'm going to show now that I think is extremely powerful, and it's 5 women who have been sex trafficked in New York, and they are talking about their experiences with the medical profession. And so I'd like to start with that, and then we can go into more discussion. Oh, next slide. There we go.
My name is Dana, and I was a victim of human trafficking. I came from a regular home with 2 parents. This happens to American girls in any neighborhood, in any state.
A lot of people think about it when they think about being sex trafficked, when you're being brought from another country, chained up and behind. But I mean, girls from our community are being kidnapped or brainwashed, being sold and being beaten every day, scared for our life.
And it happens right here in the community, and people don't usually recognize it because they don't know what it is.
Or they think it's a joke. Or they just see these girls and they think that, they want to be out there.
Right.
Nobody doesn't want
to be out
in the street.
And I think it's also important for doctors and nurses and care providers to understand that we are victims and not, just prostituting by choice.
All of our stories is different.
But yet we've all experienced
the same thing.
Manipulated to, lied to,
brainwashed,
brainwashed.
raped,
not being
kidnapped,
fed,
starved.
feeling like you're nothing.
It's literally like you're living a whole other life. Like you're not even a part of actual life, of like
Of
living
society.
Like it becomes a whole separate world
People
in
look
itself.
at you differently.
Like
You
when-
begin to think that what you're doing is normal.
And it's right, and you're isolated
And that
from
you're
the
okay,
usual
and
friends
that
and your
this is
family.
how your life is
I've
going
always
to be.
expressed the way I felt about it. Like, you know, like when I was younger, we would walk past a bum on a train station and look at him, and like he's so out of it, and nothing else. Like what we say or do doesn't matter to him because he's just like in different worlds. And that's how I felt once I became in the life. I felt like that bum that would sleep on that train station because it was a different life. Like I would
Right.
hear people talking, but what they were saying didn't matter.
Even
when you're in life, nobody will offer you nothing unless they want something from you. You know how many people be out in Times Square every day. I done got checked, beaten in front of Port Authority, like just, outright like stuff, violence happened to me out there, and nobody never said nothing to me. Nobody asked me if I was alright.
like it's okay.
Nobody
like it's
did
nothing.
anything to help me. So when stuff like that happens to you, you really begin to feel like you're not even worth
You're not
nothing.
even a
Like
human being. Like,
Police are like a whole nother issue when you're in the life. They want sex in exchange for whatever you need their help for. There is no sympathy, there's no empathy, there's no nothing. It's just, oh, you want to be a hoe? Then we're going to treat you like a hoe.
I think it's important for healthcare providers to also understand the mental, not only the physical that's going on with the young women, because keep in mind that they're being constantly manipulated, brainwashed.
not to talk, but they also,
They're trained to lie about. We as victims, I was trained like you wouldn't believe, to lie about my age.
sometimes when a girl, like you say, like it's not easy. We deal with trauma, we deal with like certain things every day, so it's not easy. Maybe we might have an attitude, but the attitude is just really a cry for help. And I explain that all the time. When girls have these certain ways that they talk, they have an attitude. It's one, because they've been doing this for a long time. They don't really know how to speak well, or or proper, or really know how to express how they really feel, because they don't get the chance in a life to express how they feel, because your feelings don't matter or count. So when you go into the doctors and you get like kind of hard for you to express yourself, and when the doctors feel like, oh, she just has an attitude. No, it's not that I have an attitude. I'm getting upset with myself because I can't really express how I feel because I don't know how to.
And we're so conditioned to the abuse that we just pass it on without realizing
See,
that we're doing
it.
the same thing.
If I'm going to the hospital, it's because I want help. I want you guys to help me. They might hit that day where you're just so tired, and then you just want that help at that moment. And like, there's been times when I went to the hospital, I'm just like praying for somebody to ask me a question.
Victims are in constant paranoia. It has been other times that I went to the emergency room. I be wanting to take, how they have like brochures and stuff. I be wanting to take that stuff with me, but I'm scared to take it, because if I take it home
And he
finds it, and at the end of the day, he didn't want me going to the doctor without him. That I went to the doctor without him, it's gonna be a problem.
So some of the things that do happen,
being burnt, with cigarettes.
Even
with
some girls
chains,
even
with
get lit on
punch
fire.
in the face.
You'll have like 7 or 15 guys rape you.
A lot of doctors, they're not educated about the issue itself, so they have their own opinions already before even stepping into the room and having a conversation with a victim.
They are very judgmental in the time of need.
One of the barriers that would shut a person down when you're in the emergency room and the nurse or the doctor asks you how many sex partners they have, but along with the face of an attitude, just because they don't like what you're wearing, or they see that you're in a short skirt, can shut a person down. But also, like, when they ask you not just how many sex partners you had or you're sexually active, and you give them an answer and they're coming back with your answer like, how do you not know, or like, what do you mean? Or
Their facial expressions
It's
will
screwed
make me
up,
not want to
and
answer any more questions. It's going to make me want to just walk out.
I feel like sometimes they see that there's signs, because like I've been to the hospital where they've asked me how many sex partners I've had, and me being like 13 years old, 14 years old, and I'm like, I don't know, like I'm sitting there thinking, I don't know, I'm afraid that you can tell that I'm nervous to give them an answer, and that she's looking at me like there's something wrong, but she's like she knows there's something wrong, but she's like kind of like ignorant to the subject, so she just doesn't really like care.
You're asking us what assumptions they should make, and I'm not sure that they should make assumptions. I think that they should help the situation first, and then see what other help the victim is willing to take. Offer as much help as you possibly can, and just whatever the victim decides to take is, on her.
First time I ever went to the hospital was when I had fractured my ankle. Another lady came from downstairs and she asked me to get up, and I'm like, get up. I'm thinking she's taking me somewhere, but I guess she just didn't want me to sit in those seats or whatever, and she moved me to like a metal chair, because it was like cushion seats and I had a skirt on, so I guess she felt like my private or whatever, because she was just looking at me like, can you get up? Like, can you get up? And I'm like, get up to go where? You want me to go in the room? She's like, no, can you sit on this metal chair, because it's like more sanitary. She said something about it being sanitary. I thought she was asking me if I needed a sanitary napkin. She was just nasty. Everybody was like nasty to me. Like when she asked me like, oh, how many sexual partners you had, because I had an STD. How many sexual partners? I'm like, I don't know. And then when it came out later that I was pregnant, because that's when I found out I was pregnant, she was like, well, that's what happens when you have sex.
Like some tips that doctors and care providers should look for when identifying a C-sex victim or human trafficking victim is like coming in at 4 or 6 o'clock in the morning with no clothes on, tattoos, like in the neck area, lower back area, things that say like daddies or initials, bottom, looking pale, sick, like she hasn't slept in a couple of days.
Or if she's with a guy, and she's referring to him as daddy, and obviously he's not.
Or if he's very persistent on her, like she cannot make a move, or he's right behind her.
Or she keeps looking at him for his approval, like
or
every
she
time.
has her head down
Bruises
and won't
or
look up.
slashes on the face.
Like certain areas, like that, there shouldn't be black and bruised, like
on the chest,
she didn't
maybe,
hurt herself. But a girl who's in her life doesn't look fine. She doesn't look healthy. She has bags. She's skinny, or like even if like she's like a big girl, you can tell that she hasn't been eating. Like her skin looks pale.
What are they wearing when they come to the hospital? Like, if it's winter and there's snow on the ground, they're coming in the hospital with open-toe shoes and
a mini skirt with no stockings, no
jacket.
Or even just
that
tights,
is a sign of sex trafficking.
Like really black spandex tights with no underwears on, and like just a little like lingerie top.
Or no underclothes on, like no bra, no panties.
He would make me put a piece of a sponge, like a house sponge, inside of me, and it used to get stuck from multiple dates, and I would have to go back and forth to the hospital to have them take it out.
Condoms being stuck in
Or the
tampons being stuck.
A baby wipe
Tampons,
was stuck up
baby
once,
wipe.
and I went to Brookdale, and as a doctor, I would just want to know, why are you sticking a baby wipe up your vagina? So when he asked me, he did ask, and I said, to stop the bleeding. Why would you want to stop the bleeding? Like, that's healthy.
The reason why it's something that they should look for is it's something that is done all the time, because when you're on a date and you have your period, you don't have the option to not take the date, because your pimp is going to force you to take that date regardless, because you need the money. If a nurse or other health provider wants to know if a victim is being trafficked, it's important to be subtle about it. You don't want to use the words prostitute. Offer help and say, you know, I know sometimes young women can get caught up in the life. I think it's okay to say the life. You don't want to say get caught up in prostitution.
If a doctor or nurse wants to know what's going on with me, what they should ask me is more like questions, like, you know, getting to a point, like, you know, how I know certain things can happen to lead to certain situations, or I know, you know, young girls are vulnerable to certain things. Rather than make me say me, yeah, rather than, you know, having me like nervous or have the pressure on me, you know, and making me say things, you know, he can say it and then just have me say yes, no, maybe, you know, like little things, rather than just having to explain to him. Maybe he can just open up the conversation.
Generalize it, not make it not about me per se, but make it more like a general situation, like conversation. Like, you know, I know a lot of, you know, girls can be affected by this, or I know a lot of, you know, girls, you know, like just not make it so much about me, but more like in a general kind of way.
Last time that I went to the doctor to be treated, he was there. Like, who was to say that you didn't ask him if, you didn't ask me if I wanted him to step out the room. I just feel like there's a better way that they can do that. She can say, you know, I need to speak to her for a minute, or we need her to sign papers, or
let's take her for x-rays, or something.
There's something that can be said, because domestic violence is a huge issue.
They put me in a room, and he was in there with me. And that's what I was about, like what I was saying from the beginning. Like, I didn't appreciate the fact that he was there. He was there throughout the whole thing, because he was making sure like what I was saying to them was, you know, all right. Because he was I guess because I don't know if they were scared of him, because he was flipping out a nurse, and she, once they moved me to the room, she was offering him a seat. Like, she offered him a seat before she even offered me the seat.
I don't remember ever getting like a follow-up appointment made, and they might have suggested that I make a follow-up appointment, but I feel like if they kind of make it more mandatory and say, listen, you need to do this follow-up appointment.
Or not even, or come back in the room like, oh look, I took the time out to make this appointment, it's on such and such day at this time, and I'll be glad to see you on this day. Like, you know, like just come back in the room with the appointment like, already made, and you kind of feel like, wow, like this lady just took the time out.
And that gives me an excuse to go back to my pimp and say, oh, she told me I gotta come back on this day. And that gives me a reason to just get away from him. One question I would have appreciated hearing on any of my visits to the hospital was, do you have somewhere to go? I think that it would have helped to have a social worker or something say, here's my card, come back.
If I'm gonna talk to a social worker and I'm gonna like express like what's going on, it's like you need to have not a plan, but it needs to be some type of structure. Because you gotta understand,
when I walk out
the life is really structured. Your time, everything is on time. Everything is done a certain way. So you get kind of used to being in a structured environment. So it's not like you're not gonna leave what you already are accustomed to like talk to this social worker. You don't know what she's gonna do. Like, you're not gonna put your life in her hands.
I'll send a social worker to you.
Don't send me somewhere else, because the more people you send me to, I'm just gonna get cut off.
If I was sitting there and I don't have nothing, a doctor walked in like, you know, here's a care package for you, you know, maybe to help you out. That alone will break the ice. Right. So for somebody to come and give you something just off the fact because they see that you don't have it, that's a lot, because in the life you just expect, you don't get, you can't get, you know what I'm trying to say, like, everything is for something. You don't get, you know, generosity. You don't get somebody, you know, rubbing your back telling you it's going to be all right.
Okay.
So those are the kind of gestures, and, you know, that's why I say body language is key too.
Please give us an option, like whether we want a male doctor or a female doctor, you know.
Oh
Like,
yeah, they used to ask that. They don't ask us that
if it's
as
a
often.
female and you see she's underage or even overage, like ask her that question. You know, that would make her feel like, oh, they actually care. Even if they don't understand, to show the support.
So I just like that video because I think that has more impact and tells you more than anything that I could stand up here and talk to you about. But a couple things that I would like to reiterate. So there is a concept of what they call trauma-informed care. So that providers should recognize that any traumatic experience is going to impact a person and how they perceive themselves and their bodies. And so keep in mind, they're going to be hypervigilant about exams. As you can see from this video, oftentimes there's a mistrust of healthcare providers because they haven't always had a lot of positive experiences. They may be very anxious sitting in a full waiting room of patients with lots of things going on. And generally, they're going to be very fearful of any procedures, and even things that you might think of as routine, especially for a teenager. That's probably going to make them very nervous. So as a provider, you need to be non-judgmental. As I think they stated very clearly, deliberate with your word choices. And again, you know, when you're talking general terms as opposed to being very specific about the person is sometimes a good approach initially. And you have to be comforting and kind of have an attitude that no one should be hurt, and be respectful. And you need to care enough to ask some of the questions that the women were talking about too. And so things to consider: where are you from? How did they get to where you're seeing them? Do they have a place to stay? Is it safe? Are they free to come and go as they please? You know, if they have tattoos or you're seeing bruises or other physical signs, how did they get that? You can ask them if anyone has ever paid someone else to have sex with them. Do they have a boyfriend? How old are they? Have they run away from home? So really investigating what their social situation is. And again, they're going to tell you what they're comfortable with, so they're not always going to tell you everything that you ask them. And again, I think as they demonstrated, patients, a lot of times they're going to be angry, they may be hostile to you. And I think as pediatricians, everybody's kind of used to seeing those teenagers that just in general have attitude, and you can get really frustrated dealing with it. But, you know, a lot of times I always say when I get that kind of attitude, try and kill it with kindness, because a lot of times if you just continue to have your same attitude, if you don't get frustrated with them, and it's almost like wearing them down, and you just keep being respectful, being comforting, being kind, eventually you can break through that with a lot of my patients. Again, self-harming is very common. Sometimes they'll be more withdrawn, they're numb, dissociative. And, you know, there's no right way to approach a trafficked person. But I also think it's important to encourage them and empower them to participate in the care. So if you are seeing them and they have a problem, you know, very clearly explaining what the issues are, and giving them some options in terms of treating it. Because we all know you can prescribe whatever the heck you want to do for them, but if they're not going to buy into it, they're not going to do anything that you tell them. And so, you know, I lay it out and say, look, this is what's going on. This would be what I would recommend, but if there are other choices, give them a choice and let them pick what they want to do. Because again, if they're actively participating, they're much more likely to follow through with your recommendations and much more likely to follow up with you. And ideally, you want to have a safe space for them too. So a welcoming environment, you know, like the girl who was in the emergency room who was asked to move to a metal chair. You know, that's not going to be a very positive experience. I would be shocked if she went back to that emergency room. They need to know that they have rights, you know, that patients, because a lot of times I think people feel that they don't know that they can refuse an exam, or that if they're not comfortable with something, they can tell them no. They need to know they can do that. And the other part is, yes, as a provider, you have to be knowledgeable about this stuff, but your staff does too, because it's not just their interaction with you and even the nurse. It's the person, you know, checking them in at the front desk, or your MA. All of their interactions with them are going to impact how they perceive their care. And remember, every encounter can be positive or negative, so you can make this a good experience where they're hopefully going to come back, or if it's negative, then, you know, you may not see them ever again. And also explain what you're going to do before you do it. Because again, and I know I see this as a gynecologist, I have seen women that are late 20s that you would think by that point have had pelvic exams, know exactly what's going to happen and be comfortable with it. Some of them have never had a pelvic exam, they've never seen a gynecologist, and they've never had a pap smear. So don't always make basic assumptions about what their experiences have been. And a lot of times they're afraid. So I hear this over and over again, especially from a gynecology point of view. They've never been tested for sexually transmitted infections, and they want to be tested, but they're very afraid that the results are going to be positive. And so part of them wants to know, but the other part is afraid to hear the answer. And so, you know, make sure you figure out what their concerns are, and it will help you develop a better relationship. And then, like I said, try to empower the patients. Let them make choices about what they're comfortable with and what they want to do. And so just as a summary, you want to support the patients, they're victims, try and remember that. If you just listen, you know, I think that's the biggest thing you can do. So whatever they're willing to talk to you about, you listen. That's going to go a long way in developing a relationship. And again, try to come up with a mutually acceptable treatment plan, not just try and tell them what to do. And you know, one point they made in this video was scheduling follow-up appointments, which I know that's a little bit difficult from an ER perspective, but I don't know, maybe that's something that we need to look into. How can we, you know, schedule certain appointments for them so that they do have scheduled follow-up. And after a victim is identified, if they are under 18, you notify the police and Child Protective Services. There is this Human Trafficking Resource Centers, which you can always get in touch with. And the National Center for Missing and Exploited Children is also another contact info. If they're over 18, they are adults and it's their decision. So as a victim, if they do not want to report anything, that is their choice. So again, in those situations, provide the services that they need, provide them follow-up, referrals. But again, it's their choice whether they want to do anything or not. And then those are just some of the references in the talk. And then I would like to introduce Jade, and she kindly agreed to come and tell you a little bit about her interactions with healthcare.
Hello, everybody. My name is Jade. I'm a graduate of the Where Hope Lives program, and it's a program for victims of human trafficking. I got into the hands of my trafficker when I was 14 years old. I'm originally from Beaverton, Oregon. I grew up in a good household. Both of my parents worked. I went to good schools. I was a good student, and I ran away from home when I was 14. And at that time, I met my trafficker. I was still a virgin. I didn't even know what sex was, and then I started, older men started doing stuff to me that I didn't know what was happening. I used to cry about it, and I didn't know why it hurt. I just knew that it hurt. The first time I went to the emergency room was because I got drugged by a car, and my whole back, I had road rash all down my back, and when I went to the emergency room, I used his sister's insurance information because she was 23 years old. And my trafficker, he was only 2 years older than me at that time. He was 16 and I was 14. And when I went there, I don't remember what I told them, but it was something to where now it's like somebody should have noticed, somebody should have known. I never went to the doctor because I was scared. I was scared of what they were going to tell me. I much rather would have just not known than had got, you know, a test back that came back positive or something. So I never went. And since I was underage half of the time that I was working, I didn't have any insurance information. I didn't have any parental consent, so I just never went. I had cavities. I mean, I was constantly taking Tylenol and stuff because I was hurting. If I was having complications, I just kept going. I didn't let it really faze me. When I turned 18, I got my basic access. I came out here to Arizona. I got left out here by one of my traffickers when I was 18 years old. And I had went to go get my tooth pulled, and it hurt so bad that I never went back to the doctors. I refused to go to the doctors because it hurt. And I didn't want to be in pain, so I never went back to the doctors. I came to the Phoenix Dream Center July of 2016, and at that time I was 24 years old. I had been trafficked for just around 10 years. And when I got there, I was so scared to go to the doctor's office downstairs. But there was just something different about the doctors downstairs because they knew that I was trafficked, so they were really, really nice to me. Like, really nice to me. And it was really nice to encounter people that actually, like, they didn't ask me a whole bunch of questions. They didn't ask me how many sexual partners that I had had. They didn't even go into that because they already knew that that was a sensitive area. When they did do stuff, they told me they literally walked me through the steps of what they were going to do. They didn't just tell me the procedure that they were going to do and expect for me just to follow along. I mean, I was 24 years old. When they asked me the last time I went to a doctor's, I said I was 14. At that time, I was 24. You know, it's not regular for a woman at that age to not have been in at the doctor's office. Because now I go all the time just because I can. Yeah, it was really, really nice how they, how just gentle they were with me. Even when it came down to like group counseling, like when I came downstairs, they remembered my name. When I turned 25 years old, I was really sad because that was my last day of group counseling, and I didn't want to stop going to PCH because of the providers there, because they were so kind to me. But now Dr. Williamson is there, and I mean, she asked me questions. She wants to know what I want to pursue. I'm a full-time student now, so she wonders how I'm doing and how I'm progressing, and I feel like it's very important when you come across people that are actually trying to put forth the effort that you sit there and you kind of root for them and come alongside them, because everybody needs somebody. I mean, there's women that have gone through the program that are graduates of the program that want to become nurses, so these can be your coworkers that you're dealing with, and it's really important to just have a good approach when you're with anybody that you're dealing with, because you never know what anybody has, gone through. For myself, coming out of that lifestyle, I tend to be really standoffish towards people. And when it comes to, like, healthcare, like, and people that work in the doctor's office, I want to be able to be comfortable to tell you my background, to know that you're not going to judge me or make me feel a certain kind of way, especially when it comes down to women, because I'm very intimidated by women because of the things that have happened to my body. So especially when I'm dealing with like a female doctor or a female nurse, it's very important that you just take precautions. And that you don't make her feel uncomfortable because of the things that she's went through. But, yeah. Yes. Mm-hmm.
We're just going to have a panel with all three presenters now, so we've got a few minutes for questions if Dr. Beaumont and Dr. Williamson can come up. Go for it.
I was in contact with my parents, but you can't help somebody that does not want to be helped. At that time, I was so brainwashed that It was more about being popular. I wasn't the popular girl at school. I didn't have friends. I was the girl with braces and glasses and headgear. I did not have any friends. So prostituting, it made me relevant to people because I had stuff. And it made me popular. And what girl at 14 does not want to be popular? So when it came down to my parents, they then became the bad guys in the sense, because they wanted me to come back to this place to where I wasn't going to be getting that kind of attention. So I got used to that. I got used to older men paying me attention, even though it hurt. It did not feel good. The next time that I went to the ER, I had tried to kill myself at 23 years old because I was so tired of what was happening to me. And I just wanted it to stop. And at that time, I had to get stitches in my hand, and they had asked me what had happened. And I lied to them. And I told them that I'd gotten into a fight with my boyfriend. And they asked me if I was right-handed or left-handed, and I told them right-handed. They said, "You must have been really mad because I tore my left hand up." And when the police came, they had me go to UPC, and when I went to UPC, I acted like everything was okay. And so they released me, and I went back to the pimp that I was with. It's urgent psych care. Yes?
I have to say, first of all, I'm so proud of you all. I just, in the background, if I can ask you this question, I was an acting medical director to develop the clinic and wrote the plans up for it before these children came over and took over. So Dream Center is close to my heart. And I've been involved with moving more than a dozen women out of trafficking situations personally. I want to tell the young residents in here, though, you guys make a very good point about contact. Obviously, most of the contact occurs in emergency centers. When I was acting medical director at Dream Center, we were putting this plan together. I said, make sure that we go out and outreach in emergency centers, not in so much primary care physicians, but emergency centers. Because A, that's the place for first contact. B, that's also a place for security. Because you made some good points about how you should ask, like, the pimp, pimp is what pimp is the, and you want to try to separate them and ask them when you want to be by yourself. For the most part, it's not going to happen. It's not going to happen, and then it becomes a very dangerous situation. And I want the young physicians in the group to understand that. I mean, you need to be able to identify this, of course, but you also need to be able to identify danger. And that's a dangerous situation. I've had that occurrence 4 times at least. And I'm 6'3", 220. And I'm from a certain environment that I have a way of dealing with that kind of situation. Most people don't. And I'm very, like you said, I'm very passionate about this. So I want to make sure that you all now, as you hear this story further, are doing that education or to urgent cares and emergency centers. Those doctors need to hear this talk, really, much more than most people in this room, even though it's important to still too. So are we doing that now?
Yeah, right now, actually, we're trying to partner with Dominique at ASU to get out into the emergency departments, and we have a resident here, Dr. Fala, who's interested in creating a learning module that we can continue to do with our PR staff as well as fellows. So that is a plan. From a provider's perspective, I'll often do things like, we need to get a sample of your urine. Here, come with me. Here's a cup. I'll show you where the bathroom is. And that's when I'm often asking questions or trying to separate. I don't know what experience you have.
For myself, if you don't force me to do it, I'm not going to do it. So especially if you know that it's a dangerous situation, it'd probably be in your best interest to tell them that this is what you have to do. Like, you can't be in here while I do this, because a lot of girls won't talk to you. Like if I went, until I was ready to change, I wasn't. I mean, you literally had to wave it in front of my face like, this is what you need to do. So if I were you, I would, just separate them, like, without asking, like, oh, do you want them to be in here? Like, no, you can't be in here. I myself, I had a lot of friends that had children, and it's kind of really risque because with any mom and her child, you know, that becomes a very dangerous point. I mean, pimps are dangerous, but moms are worse. But I don't know.
Well, I know from an OB point of view, so if I do have a teenage pregnant patient that I'm seeing, wherever it is, you're asking them, you know, who the father of the baby is. So again, age doesn't always make a difference, but if dad is significantly older, or you know what the situation was, teens are automatically a social work referral when they deliver at the hospital. So, you know, social services is going to be involved. Now again, it depends on what the situation is, if there's any past, if anything, you know, is investigated further. The Dream Center, you know, the women there's several of them that have babies, and they're lucky they can keep their babies with them. And so they're doing a pretty good job, most of them, I think, with their little ones.
How do you get involved with the Dream Center? Is that something that the woman identifies herself and gets reported in?
Constance, do you want to talk about that?
So there's several ways to get involved with the Dream Center. Are you talking about as a client, or are you talking about like as a volunteer, a medical provider? Well, I meant more as the
Client. When I came to the Dream Center, I had been working, and I had a trick rape me, and I went and they did I went to a doctor, and they did all that stuff that they do to you when that kind of stuff happens. And I met with this officer, and I don't like her at all, but she introduced me to the Dream Center. And when I finally was ready to change, I wrote her on Facebook, and I was like, I need help. And she sent a victim's advocate, and that victim's advocate brought me to the Dream Center. And that was in July of 2016. And I feel like when it comes down to it, there's a whole lot of, I came and I left, and I came and I left. But once that door is open, then, I mean, the Dream Center is like my home. I mean, I'm a full-time student now. I'm a graduate of the program, but I love the program so much, and my director loves me so much that she made an alumni program so that I didn't have to leave, so that I can continue to stay safe.
We work with all kinds of different law enforcement. We have a task force, which is part of our Department of Justice grant, which includes the FBI, Homeland Security, some people from Trust, just kind of like everybody. It's a collaborative effort for everyone to come alongside of everyone to make sure that we can tackle this issue. We have a 24-hour hotline that we get the card out to everybody, including pimps, and let them know, because there's pimps that want to get rid of their girls as well. So it just says HOPE on the card, and it's a resource hotline that actually Jade runs, because it's nice to have a voice on the other side that kind of knows what you're going through. I used to run that before I took my current position, and now Jade is in charge of running the intake hotline. So there's so many different ways. We get them from law enforcement, we get them from other states, because we also are known as one of the leading human trafficking programs in the nation. So we also get them from other states, which is very good to take somebody out of the state and put them in a different different state because they don't have anybody to run back to. They don't have anybody really to contact unless their pimp wants to come out there to get them or send them money, which mostly they don't even have their IDs because pimps already have that. So getting them out of the state and getting them into a place far away, their chance for recovery is a lot higher than them staying in the same state. So we get them from everywhere.
Jade, we very much appreciate you sharing with us this morning. And we'll ask her to stick around for questions if you want to come up. Thank you.